many of you may be aware, the Community Health Fair for January 22nd of 2022 has been canceled due to our extreme high positivity rate in the community. Sarah and I are here with you today. Sarah is our monoclonal antibody infusion nurse, and we have been providing infusions, well, for over a year now, but for the last 8 weeks, pretty steadily heavy. And we have a lot of information that we would just like to provide to you as a community. So we just want to start out by saying, if you're having any symptoms of COVID-19, which may include allergy type symptoms, or some people think that they have a sinus infection. We've had severe fatigue, nausea, vomiting, diarrhea. Sarah, can you think of any other symptoms?
Loss of appetite, maybe more of the body aches, fever, chills, those types of things.
Yes. So if you're having any of those symptoms at all, please stay home, first and foremost. Call your physician's office. They'll schedule a virtual visit with you so that they can make arrangements for you to get tested for COVID-19. In the meantime, and even if you just think it's allergies, please just put your mask on no matter where you're going or what you're doing. We can't say how important it is to wear your mask. We work around COVID-19 patients all day, every day, and they have their mask on, we have our mask on. We're not contracting the virus at work. All right, so one of the things that I like to share with our patients whom we are providing infusions for is there are very important things that we need to do at home to help us to keep from getting very sick. And so two of them, and they're very similar to after you have surgery, is we must drink water and we must move. This helps to prevent us from getting those serious complications of COVID-19, which are blood clots and pneumonia. So by drinking plenty of water, we're able to keep our respiratory secretions nice and liquefied so that we can cough them up. And by moving, that helps to keep us from getting blood clots. Unfortunately, when people don't feel good, they literally lay around for days, they're not moving, and this is when blood clots form. So you should drink a minimum of 64 ounces of water a day. That's not even really the recommendation. The recommendation is closer to 100. And you should try to get up and move every hour while you're awake, even if it's just going to the bathroom because you're drinking so much water. We're here today just to educate you. We want to provide you some great information so that you can make an educated decision on your own, actually. And so what we know is that in the Mosaic system,
about how this may protect you and your family.
80% of the people who are hospitalized are not immunized, and 95% of the people who suffer death from COVID-19 are not immunized. So what we want to say to you is we just want to give you a little bit of information about the immunization, actually. So we've had patients here in our infusion clinic. They're like, well, I just don't feel like I'm very well educated. All I hear is what my friends and family tell me or what I see on social media. So here we are on social media, and we want to just tell you a little bit about the vaccine. So what the vaccine does is, you receive the vaccine, and for those of you who remember science class, you have your cell and your DNA and your mRNA and all of that. And what the vaccine does is it kind of sends a message to your mRNA that says, hey, this is what COVID-19 looks like, and if you see this virus coming, don't let this inside the cell. And so then by preventing COVID-19 from infecting our cells, then we prevent ourselves from getting those serious side effects of COVID-19, which include the pneumonia and the blood clot. In the event that you have had the monoclonal antibody infusion, or you have actually had COVID and not had the infusion, there are a couple things to consider. After a monoclonal antibody infusion, you do have to wait 90 days to receive your vaccine. You also have to wait 90 days to get a booster shot. And for those of you who are a little bit confused about why we need to get a booster after we've been vaccinated, let me just explain this to you. So this is fully protected from COVID-19. Our first shot for the vaccine, Pfizer or Moderna, brings us up to about 75-80% protected. Our second shot brings us up more to the 99% range, and over time this starts to wane down a bit. And so that's why they say after 5-6 months they would like you to go ahead and get that booster shot to bring you back up. So as this wanes down, you become less and less protected. Those people who have underlying health conditions and who have their immune system is compromised, their immunization rate tends to wane down a little bit faster than those with a healthy immune system. So that's why we may have to continue to get these booster shots. Have had COVID-19 and you are interested in getting your vaccine, the rule is that if you are asymptomatic, you are eligible for a vaccine. So your provider may say, well, I want you to wait 2 weeks or whatever that is. But if you contact your provider's office, they will give you the recommendations for how long they would like you to wait to get your vaccine.
So in the event that you need a COVID vaccine or booster, you can call your primary doctor and let them know that you need to schedule an appointment for that. Or you can actually call the health department and set up an appointment there.
Get an immunization at Hy-Vee or Rogers Pharmacy here in Maryville, as well as other pharmacies throughout the region.
With the new CDC guidelines for quarantine, it is important to note that the first day that you start symptoms is day 0. So actually 5 days of quarantine seems more like 6. So you start with day 0, then go to day 1, and so on. It is also important to note that after your 5th day, that if you are going out in public and being around other people, that you are wearing a mask that fits properly and goes over your mouth and nose.
So the other thing you want to remember is that on the day number 6, you can go out into public with your mask on, but you need to do that for 5 days. And that is only if most of your symptoms have resolved. If you are still having a fever, coughing, runny nose, fatigue, you should not be going out into public, because this means you could be still shedding the virus. So we urge you to stay home if you're still having severe symptoms of COVID-19. Remember, once you are feeling better and you're out into public, it's 5 days with a mask on. And then on the 11th day, you can return to your normal behavior. But we would just remind you that anytime that you are having any sort of symptoms, runny nose, fever, cough, anything like that we spoke about earlier in the video, please just wear your mask if you're going to be around others. It doesn't matter if you have influenza, COVID-19, or just a common cold. We should try not to spread this around. We never know who we may be encountering that honestly just can't fight off these diseases on their own. So again, our purpose for today is just to get this information out to you. I know I, for one, am personally very sad that we're going to be not be able to hold a community health fair, but as a healthcare facility, it is our responsibility to protect you and the rest of our community from disease. And so we feel like hopefully by providing this information to you and giving you the education that you need, you can make a real good decision for you and your family to help us to win this battle against COVID-19.